Hello, it's Dr. Rhonda Johnson, and today is Thursday, October 8th, 2020. And today I'm going to be discussing a topic that, quite frankly, I don't want to be discussing: death and dying. And I'll be sharing excerpts from an extraordinary article in one of the world's most prestigious medical journals. So, there have been more than 211,000 people who have died over the 260 days since our first case occurred in this COVID-19 pandemic. That is roughly 800 people who have died daily since the first case was diagnosed. And I'm going to stretch a little bit because sometimes it's hard to imagine what a number like that really means. So let me take you to an event planner. Now, event planners say that 50 people easily fill up an average size room. So using this analogy of people in a room, 800 deaths daily is like having 16 rooms of people die every day. Now multiply those 16 rooms of 50 people by 260 days since this pandemic started, and you will have 4,160 rooms of people, assuming 50 people to a room, who have died. Please let that settle in for a moment. 4,160 rooms of people who really should be living their lives in whatever way they were living, all dead from this killer virus in 260 days. Now that is beyond tragic. I want to discuss now, moving forward, an article published by editors, all of the editors, in one of the world's most prestigious medical journals, the New England Journal of Medicine, which was released on October 8th, today. The editors, who were physicians, cite a failure of leadership. They state our nation's leaders have taken a crisis and turned it into a tragedy. They go on describing the magnitude of this failure, citing how the United States leads the world in COVID-19 cases and in deaths, how the death rate in this country is more than double that of Canada, exceeds that of Japan by a factor of almost 50, and dwarfs the rates in lower middle income countries such as Vietnam by a factor of almost 2,000. The article says that if we had done aggressive contact tracing and appropriate isolation, we could have come close to eliminating this disease. The authors contend that the United States has failed at almost every step. We failed at testing effectively. We failed at providing the basic personal protective equipment to healthcare workers and the general public in the early phases of this pandemic. We continue to be way behind the curve in comparison to other nations in testing. We have failed at facial masking, according to this article, largely because our leaders have stated outright that masks are political tools rather than infection control measures. Now, our government, this article acknowledges, has appropriately invested in vaccine development, but the rhetoric around this vaccine has politicized the development process and led to growing public distrust. The article acknowledges that our country has an enormous advantage, such as tremendous manufacturing capacity and biomedical research. Our healthcare system is the envy of the world. The authors state that we have enormous expertise in public health policy, in prevention, and biomedical research, but that advice is being ignored. We have the ability to turn that expertise into therapies and preventive measures if our leaders would just follow the advice of experts instead of denigrating them. The authors state how the CDC, which was once the world's leading disease response organization, has been what they call eviscerated. And the NIH, the National Institutes of Health, has been excluded from government decision making. And the FDA, the Food and Drug Administration, has been politicized and bows to pressure from the administration rather than sticking to scientific experts. They say that this administration has turned to uninformed opinion leaders and even charlatans who obscure the truth and facilitate the promulgation of outright lies. The article outlines the price that we have paid here in this country, that many of our children are missing school at critical times in their social and intellectual development, that healthcare professionals have put their lives on the line and have not been used wisely, that communities of color have been disproportionately affected, that many businesses aren't able to reopen because of this ongoing pandemic, resulting in hundreds of billions of dollars and millions of jobs. And then there's this statement, which I will read verbatim. This article says, anyone else who recklessly squandered lives and money in this way would be suffering legal consequences. Our leaders have largely claimed immunity for their actions, but this election gives us the power to render judgment. Truth is neither liberal or conservative, the authors note. When it comes to the response to the largest public health crisis of our time, our current political leaders have demonstrated that they are dangerously incompetent, this New England Journal of Medicine article says. We should not abet them and enable the deaths of thousands of more Americans by allowing them to keep their jobs. Now, all of that comes from this New England Journal of Medicine editorial. Now, I have said this before, and I will keep saying it, that leadership is the stewardship of lives entrusted to you. Dr. Fauci has offered a grim image of this coronavirus pandemic this week, saying that between 300,000 and 400,000 people could die from this disease in the United States this spring. Now, this would really be a tragedy. So, folks, in the absence of our government leadership, we are left with just staying the course. Continue to practice the 4 W's, as I call it. Wash your hands, wear your mask, watch your distance, and keep a window open during the winter months so that good ventilation will minimize the risk of airborne transition of COVID-19. This is Dr. Rhonda Johnson. My views are my own. I will include the reference link to the New England Journal article so you can read it for yourself. Have a blessed day.